Hi, my name is Melissa, and I'm a married mom with 3 girls, and I have pectus excavatum. And the reason why I'm doing this is because next week on the 4th, I'm about ready to go in and get the Nuss procedure, and I'm going to have it at the Mayo Clinic. And I guess I just wanted to see if there was any other ladies out there. The procedure's pretty new for older applicants like myself. I think in some of the research I've seen that they've even done it up to somebody possibly in their 70s. So I really wanted to know. In my research, I saw kids getting it or young adults getting it, but I never saw somebody who was, almost 50 getting the procedure and having had kids because, sorry, we moms, we're kind of awesome. We birth kids. So there's a lot of pain there. So I didn't know. I'm a little nervous about it. I'm going to the Mayo. We're totally blessed. We live in Scottsdale, Arizona, and the Mayo is a few miles away from our home, which is fantastic. I am going in on May 4th, and my sweet little middle daughter, Madison, loves to videotape everything and to catalog everything. So I've told her that she can take some information from me after I come to from the surgery. So we'll see. So we can kind of document it. Some of the information I can pass to you is my Howler index. I had to have a procedure done with this really freaky Hannibal Lecter mask on my face to see how my cardiopulmonary output was. So when I work out, am I able to breathe okay? Is that obstructed? The second test they did was a CT, and basically I'll try to upload some images to this. That basically, it's almost like they splice off here, and then it's like little image, and it keeps going, and it's really pretty fascinating. So it shows my Howler index is an 8.27, which means a 3 is severe, so I'm almost 3 times that amount. And so every time I'm breathing, I am squishing my heart. So that was something that we thought, I tend to pass out and I have some heart issues, but hopefully this will help create a sense of normalcy to me, which would be awesome. And hopefully I don't have to pass out anymore, but we don't know. So Dr. Jarzewski, which I like to call her just Dr. J, is going to be performing the Nuss procedure on me on May 5th. And that basically is she's going to put in at least 2 bars, kind of weave them through my rib cage, bolt them to my ribs, and then I think she's going to add some extra little things to it to kind of try to keep the bars in place, because sometimes that's what happens is the bars move, and that obviously creates a lot of discomfort for the candidate with the bars. So they put the bars in, and then they have a tool that flips them, so immediately your sternum pops out. So it will no longer be stress on my heart. But the procedure, when you come to, I guess it's a little painful. So that was one reason, my motivation behind this. I'm not into YouTubing. I'm not into taking videos. So this is a little raw for me. But I thought if this procedure starts to get a little more common for people who suffer from pectus excavatum, that maybe it would give somebody else some insight to what they're going to go through when they get this procedure done. I guess a couple things I'd say prior to would be my husband is amazing. He works a lot of hours and he travels and such, so I wanted to try to keep my family as normal as possible. So I really organized my freezer with meals that were prepared and little cookies and that kind of thing, so the girls could have that. Also did some other things such as organizing who will be picking up the girls from school, have my husband's secretary and put it into his calendar so he knows if there's an issue that's going on. And I got a lot of the goofy, doctor's appointments, dentist exams, all that kind of stuff done, because they say it's going to take quite some time to recover. I don't know. I tried to do as much preparation because I feel a little bit out of control. Obviously with this surgery, you don't know what you're going to end up with. You don't know if you're going to be in a lot of pain. So I made meals, kind of cleaned out the freezer. And the other thing that I did is I'm blessed to have my mom and my dad fly in from Oregon to help out. And then I also have a sweet friend from Oregon that's going to come in towards the end of May that hopefully will be coherent and be up and about. I also organized some possible home care. So I had a contact and I've already interviewed and talked to him. And then we can call him at any time to come over to the house and to have somebody come over to the house to watch me. Because as long as you're on paid meds, you can't drive. But also my husband doesn't really want me left alone while the girls are at school and he's at the office. So anyhow, I will try to upload some information and my daughter will be helping me. And we'll go from there. So wish me luck.